Okay, I want to ask the audience, have some exercise, okay? Who think that, yes, char kway teow can be used as a contraception? Raise up your hand. Who said no? Who is still sleeping? You tap your head twice. Headache, stroke, smoker. Okay? So when you see patient, when they say want the OCP, you don't tap your head, you just imagine you tapping your head. Okay? Okay. So for this birth control pill or hormonal pills, there is 3 dimensions to it. Okay? First dimension is purely for contraception. And got some medication, we can use it for menses problem, mood problem, maleism. Maleism is like male hormone, and one more is malignancy, is cancer. Okay?
Before we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like Hulk.
Hello guys, welcome to the second OC Masterclass in collaboration with OGSM and MPS. There are some housekeeping announcements. So let's say if you have any question, make sure to submit them through Slido. And also at the end of this session, there will be a feedback form for you to fill in. And this Masterclass, there will be 4 CPD points. And for those who drove here, there will be a 7 ringgit flat rate fee. If there's no parking, if you park opposite the hotel, there will be 5 ringgit. And for those virtual participants, you guys will be muted, so you're only allowed to listen throughout the session. And please turn up the volume of your computer speaker for better experience. If you can't see the slides or the screen turns black, kindly re-log in and again, and the issue will be resolved. And you may also use the chat function, and our Bayer rep will assist you as soon as possible. So today's agenda, there will be 2 topics covered by our panel speakers, which is Dr. Loh Kapin and Dr. John Teow. And there will be a tea break around 11:50 for a short 10 minutes. You can go to the toilet if you want. And after that, we will proceed to OC case scenarios where Dr. John Teow and Dr. Vijaya will be there to handle the case. So after that, for our physical participants, there will be a lunch provided after 1:30. Okay, so my name is David. I am the moderator of today. So just a brief introduction of myself. I am also a pharmacist practicing in Mega Clean Pharmacy, and also a founder of a digital health platform called Dear Kyra. So what we do is we provide a safe space for women to seek help in the areas of sexual and reproductive health. And our goal here is to make birth control more accessible than ever. So without further delay, I would like to introduce our first panel speakers, Dr. Loh Kapin. So just a brief introduction of himself. Dr. Loh Kapin is a Penang boy working in Lower Guan Lai Hospital. So he is also an advanced gynae laparoscopy surgeon and a committee member of Minimal Invasive Surgery Subcommittee of OGSM. And he is also quite active in social media. So if you want to follow him, please make sure to search him on Instagram, YouTube, A Gynae Penang. And reproductive and contraceptive health is his bread and butter of his discussion with public and patients. So let's give him a round of applause, Doctor. All right, how is everyone? Good, huh? Well, doesn't feel good like that. Okay, so since we are having it in Penang, so I thought of putting up something related to Penang. So you all can guess this is char kway teow. not KL char kway teow, right? It's Penang char kway teow. Okay, so just now initially I asked David to just give me a brief intro, just say I'm Penang Kia, enough already. Alright. Okay, so if you guys know, my name is Lo. Okay, I'm from Penang, but I'm not related to Jolo. Okay, and then I'm from Lo Guan Lai, and a lot of people always ask, are you the don't know what great grandson of Lo Guan Lai? I'm not. Okay, Lo Guan Lai is LOH, I'm LOW. Alright. Okay, so we clear up this view. Yes. Okay, so the first thing is where's my pointer? I think I lost it. Maybe later you all change the slide for me. So today I'm going to talk about Penang char kway teow. Alright, is that okay? You're hungry? No, not really hungry. Okay, next slide please. Yeah, the picture. Oh yeah. Alright. Okay, so I need to turn the slide. Okay, no, it's not turning. Okay. So question 1, I need the people in the online also to type 1 if you have tried Penang char kway teow before, and the audience here, can you all just raise your hand if you have tried Penang char kway teow before? Okay, almost all. Okay, peer pressure. Those who haven't tried will have to lift up a hand. Okay, so one thing about me is that I'm a Penang boy, but I don't take Penang laksa, I don't take Penang rojak, I don't take durian, but the only thing Penang that I take is Penang char kway teow. So I have to feature it for my talk. Okay. Second thing, okay, who had taken birth control pills before? Okay, so those online, you can type 1 in your comment box. Who have taken before? Nobody here taken before. Okay, 1, 2, okay. So the sales is not so good. That's why the talk here. Luckily, no guys, they stop their hand. Alright, so, alright. Third question is, what is the relationship between char kway teow and contraception? Do you have any idea? No idea. Anyone? How about in the online group? Anyone have any idea? You all can type in the comment. Any comment from the online? No, okay. Later I will review, okay, what is the relationship, okay? Alright. First off, I want to talk about these contraception pills, okay? These contraception pills, usually they are both, one is a combined and one is with this purely progesterone, okay? And then if you can see the progesterone, the progestine, they are very colorful, colorful and very variable contents and different types. We can see that different types got different function and they can have a different effect on the body, okay? For instance, if you see the below part like the Dinogest, they have anti-androgenic, means that androgenic means androgen is a male hormone. So anti-androgenic, it will reduce the male hormone. So it will reduce the male features, okay? For instance, the acne, the baldness, all these things, okay? And then, of course, you can see the anti-mineral corticoid means that it reduces the water retention, okay? So it's like, if you see dosperinone is a positive, means that it reduces water retention. So not necessary that if you take a birth control pill, if you have this progesterone, then the swelling will be less, okay? All right, so the next slide. Okay, this slide is like a bit all over the place. So basically, I think the slide is a bit all over the place. Hello, Michelle. I think the slide is all over the place. Wait, because my initial slide is not this one, I think. The arrangement. But never mind, I'll go on as well. Okay, so how does the oral contraceptive work? Now it's off again. Okay. Okay, I'll just go through just in case. Alright, so basically, without contraception, we can see that there's nothing will happen to your womb, your tubes, okay? But with contraceptions, oral contraception, the estrogen and the progestin, they will inhibit the ovulation, okay? They will stop the ovulation from happening, means the ovary doesn't release the eggs. Then the progestin, it will cause the endometrial to thicken, okay? This thickening, because it will reduce your implantation, means that after the sperm has met the eggs, it will come from the embryo and it come down, it need to embed, need to plant, okay? So if you want to plant something, if it's too thick, you cannot grow something because it's too thick, okay? And then the last one is the progestin at the area of the cervix. It will hamper the transport of the sperm. Means the sperm need to swim, okay? But when you have progestin, the mucus there a lot, then it's thick, it becomes a barrier. It's like a lot of this barrier for the sperm to go through, okay? Alright, so the benefit of contraception, this is a run-through general slide, okay? It's a highly effective. If per woman year 100 is 0.3 pregnancy, it's well tolerated and it's convenient and it's safe for vast majority of women and can be used until menopause in a non-smoking woman who does not have contraindication. That one I will tell later what are the contraindication. And the COCP is also reversible. So the fertility returns 1 to 2 months after discontinue. So once you discontinue, you will get pregnant. A lot of people, they have this wrong thoughts that if you take birth control pill, you cannot get pregnant later. But then I ask them a question. If you miss your pill, sometimes you see a lot of people, they take birth control pill, but they miss their pill, they get pregnant. Why? Because your return of fertility is very fast. So you cannot miss your pill. You miss your pill, there's potential that you can get pregnant. Okay? So it's untrue that if you take birth control pill, next time you cannot get pregnant. Okay? And then the efficacy, if you must know, the failure rate with typical use is 8 in 100. And if perfect use means that you don't forget your pills, you take diligently, is around 3 in 1000. So it's very effective. Okay, you can see that the perfect use is around 99.7%. Okay, and the OCP is actually preserved fertility because some patients, when they have period pain, they actually have endometriosis, and this endometriosis can actually be reduced or maintain the activity with the COCP. And COCP is appropriate for all stages of women's reproductive life. Okay. Oh, I think the slide is all over the place. Okay, but never mind, I'll just continue. Okay, before I go to this 3A, all right, actually by right, I got one more slide to answer you guys. What is the relationship between char and contraception? Actually, this question was asked by me by my patient because I said I prepared this slide and they saw the char. So they asked me, is there a relationship between char and contraception? And they were asking me, so is it you use char as contraception? Can we use that? Yes or no? Okay, I want to ask the audience, have some exercise, okay? Who think that yes, char can be used as a contraception? Raise up your hand. Who said no? Who is still sleeping? Okay, so actually you cannot use char as contraception, okay? Okay, but for me, I would be thinking a bit like, oh yeah lah, if you take char, then you're so bloated, then you won't have sex. Then it's a way to become a contraception. That's why when you go out with your girlfriend, don't bring to take char. I'm going to take fine dining, small meal. Okay, so alright, I will go next. Okay, so from the community pharmacy side, whenever you want to start the OCP for patient, you need to make sure you go through these 3 A's. Okay, this 3 A is very important because the first A is assess. Okay, this assess, can you see I highlight the letter S there? Okay, the S means for safety. Because in medical, what is our first rule? First, do no harm. Correct? Alright, so first do no harm means that you must assess safety. Is the patient safe to take the pill? Then only you go to the second A, which is ask. Ask is to mean that whether patient have any needs and concern that need to be addressed. Not just her contraception, okay? Maybe she has some other problem like she have oily skin, she have acne, she have heavy period, she have painful period. This thing need to be A, means the ask, okay? And then the last part only you advise which contraception is better for her, maybe from the sense of her needs or whether from an economical point of view. I think a lot of community pharmacy, the main thing is about the pricing as well, right? So everywhere is a price war for you guys. Okay? Okay, so So these are the 9 things that for this assess. So for these 9 things, I need to do a bit of exercise with your eyes. Okay, can you all open up your hand? Cannot, you got hands, right? Okay, all right. So the first 3 things are headache, stroke, and smoker. So focus on your head, okay? So you tap your head twice. Headache, stroke, smoker. Okay? So when you see patient, when they say want the OCP, you don't tap your head, you just imagine you tapping your head. Okay? Headache, but the headache must be with visual problem. Okay? Means migraine with aura. Headache, stroke, smoker. Can we do it again? The one in the online, you all can do as well. I can see you all. Okay? Headache, stroke, smoker. Okay? And the second part is breast cancer. Okay? So, breast, heart attack, liver. Can, breast, heart attack, and liver. Okay? So, breast, heart attack. Heart attack, this is a Levin sign for heart attack. Okay? So, breast, heart attack, liver. So, 3. Okay? The last 3 is the arm. Okay? Home, you're doing or not? Make sure you're home doing. I'm talking to the camera. So you don't look at the camera. Okay? The last part is the 3 things. Hypertension, diabetes, surgery. Hand. Okay? So, hypertension, diabetes, surgery. Okay? If you don't go back with anything, you'll go back with this. Okay? When you see patient asking for birth control pill, you go through these 3 things. Can we do it again? All together? Can or not? Can, exercise to make sure you're all more awake, okay? Headache, stroke, smoking, breast, heart attack, liver or gallbladder, hypertension, diabetes, surgery. So if she has any major surgery, then better don't start on OCP because of risk of blood clot, okay? So if you forgot this dance, okay, then you want to show that you are more modern, then you can take out your handphone and you download this app, okay? Okay. This one you go to WHO Medical Eligibility Criteria app and you see or you ask patient, you got this or not, you got this or not, you got this or not, then come out. Okay, you can take. Because the app say can take, then patient will feel, wow, this one doctor very modern, you got apps one. Not the one that tap the head one. Okay, alright. Okay, so can we move on? Everyone taken photo? If don't have photo later, you can get from the Bayer team. Alright, so I'll go to the next slide. Okay, this is a slide that I want to put both by come down below. Maybe it's a bit shuffled there. Okay, it's okay. Okay, so that is the first part of my talk. Okay, about the which one? Assess. Now is the ask. Okay, so my talk mainly is to talk about these 2 char kway teow. Okay, what is the difference between these 2 char kway teow? Anyone can answer me? Cannot. Oh, okay. What's your answer? No prawn. Okay. So you can see that this char kway teow on top got no prawn, and this char kway teow below got a very big prawn. Okay. So today my talk is to talk about this big prawn. Okay. Why this big prawn? Okay. Now I talk about more of your job. Okay. Pharmacists, community pharmacists. What is the bread and butter? The big area of your doing. I mean, what your day-and-day job is to like the medication to dispense to the patient, and sometimes I see this is the main thing that my patient, she wants some medication, she asks for it, or she has some problem and you get the medication that's suitable from OTC, over counter for the patient, okay? But this is a char kway teow, okay? Means your main bulk of your work, correct? Is that right? Okay. But the prawn, okay? The prawn is the extra things. Okay, some pharmacy, they also do blood checking, BP, and some have do the diabetes checking as well. So this is the prawn, the value added, okay? And some even go through with the patient, what are the medication that require, what are the things that can be used, cannot be used. And sometimes they will also try to do a very important job, which is to read the doctor's handwriting, okay? Okay, because in our field we say, okay, doctor handwriting, only pharmacy can decipher. They are like the, if you watch this, the museum show, they say, oh, this one is
a historian only can read the hieroglyph, all these things. So pharmacy is a hieroglyph reader for the doctors. Okay, and then the last one, oh sorry, this one, I want to bring this one slide because last time I used to see the counter and then the pharmacy will be standing there and the customer, they will be talking. But nowadays I saw the pharmacy will be sitting there on top, like this judge like that. And the patient will be lining up and ask what you have, fever, okay, Panadol. So this is some of the scene that I saw, the changes over the years in community pharmacy. I'm not sure whether your pharmacies have this kind of setup, but for me I see that, this is quite interesting because I go to one of the pharmacy be sitting up on the higher desk, and then the customer will be lining up. They were asking her, you got back pain? Back pain. How long? How long? Then they say, okay, go and take this one medication for this patient. Is it true? No. Your pharmacy setup is different, right? Okay. So all these are value added, okay? And then the last part is some pharmacy, actually, if they know the patient problem, then they can either refer to a doctor or they can refer to a specialist, okay? So maybe this part of thing that some of the pharmacy, they're doing that. I think those who are close with me, they will refer to me. They will straight message me and say, oh, Dr. Low, I got this patient, a very severe period pain. Keep on taking medication from us, but not well, maybe I refer to see you. So sometimes when you refer to doctors, the patient will feel appreciated also. Like me also, if I think this patient couldn't have proper treatment in my center, I refer to GH. And then most of the time they say, okay doctor, I'll go myself. If they go themselves, they'll have the appointment like after 1 month or 2 months. But if I call up the GH, I get that appointment, and then within 2 weeks they get the appointment, then they'll be more appreciative and they feel that I come to this doctor, even though I cannot get the full operation, everything from this doctor, at least I can have a proper referral to the GH, and then it's done without them going there and explore where to get the appointment. So for me, I feel that maybe this is something that's value added that you can do for your patient. If you want, you can communicate with me. Okay. So for me, the same. Okay. I'm a laparoscopic surgeon, and this is one of the surgery that I do. This is a laparoscopic adenomyomectomy. Means that adenomyosis, I do a surgery but through keyhole. And beside that, I have my own YouTube channel, and also I have some comics to educate the patient. Okay. So my YouTube channel basically is not to make me a YouTuber, okay? Because I calculated to be a proper YouTuber, to earn 1,000 ringgit per month, how many subscribers do I need? Any guess? Anyone guessing? 10,000? Who thinks that 10,000 subscribers? No. 20,000? No. 30,000? No one knows, okay? The answer is 50,000. Okay, so I only have 300 subscribers. So to earn 1,000, I need 50,000. So I need to get another 49,000. Okay, but actually for me, it's not to be a YouTuber. For me, it's for patient to revise. Sometimes I see a patient in my clinic. There was once a pharmacist come and see me and say, Doctor, I have a cyst there. I scan and say, oh, this cyst look big. You possibly have endometriosis. Then she like, oh, she shocked. So whatever that I talk to her, she can't get in. It's like talking to a blank wall. She like shocked, like, oh, am I going to die? Okay, so she had this thought in her. Okay, so basically this is a platform where after she go back, she can go to the YouTube channel, or she can Google anyone that explain the condition to her, so she know that she doesn't get shocked by her condition. Okay, so basically beside the birth control, big thing, like for us, for the pharmacists to dispense and to sometimes give prescribed OTC, doctors to do surgery, we have an extra thing that benefit the patient or the customer, okay? And then this is a summary of what the non-contraceptive benefit of this hormonal contraception, okay? So basically, the contraception part is the koay teow, all right? And the non-contraceptive benefit is the prawn, okay? Okay, so the prawn is where you provide other things extra for the patient or your customer, okay? And then this one is what I want to bring out is like, this is an example of a few products of Bayer's, okay? So we can see that there are different prices for this medication. Okay, I put in char because I don't want to put the full price here. So basically, you can see that 1 Yasmin is equal to 1, 2, 3, 4, 5, 5, 6 plates of char. Okay, Yas is 7 plates, but this microgynon only 1 plate. Okay, so you can see that from this, you can see that there are different value or prices of the contraceptive pill, which you can consider. Like for instance, patient, if let's say she has some heavy menses, and then she's a student, so she wants the most, the most cost-effective. Okay, so you don't ask her to take the one that's more pricey. You can suggest the one that is less pricey, like microgynon first. Okay, or if the patient say, "Oh, I'm rich, I'm tai," she drive a Ferrari inside, and she wants smooth skin, all these things, then of course you recommend like Yasmin. Okay, or she said, "Oh, before menses I have some mood disorder," then you can recommend Yas, because they got other non-contraceptive benefit. Okay, all right. So these are the things that you need to look out as well. Okay, all right. Now it's not moving. Can you change the slide? Okay, go back to here. All right. So basically, the non-contraceptive benefit is like the prawn. Okay, and then it's a value added towards your contraception. Okay, just like in your practice, you need something to value added. Okay, so once you attended this class, okay, you have added value to your knowledge. Okay, and what is this value is that you know now the safety, okay, the tap head, okay, all this thing. Okay, you know that you want to give patient the safe option, means that whenever you give this contraception, you know that you are safely giving the patient, and not any patient, "I want birth control pill," okay, you take one of your, you understand? Okay, so these are the value added. So I summarize it. Okay, so for this birth control pill or hormonal pills, there is 3 dimensions to it. Okay, first dimension is purely for contraception, and got some medication we can use it for menses problem, mood problem, maleism. Maleism is like male hormone, and one more is malignancy, is cancer. Okay. Okay, this is jumbled up. This slide is supposed to be on top. I don't know how the slide got jumbled up. Okay, so for the non-contraceptive benefit, I summarize it at 4M. Okay, 4M. Okay, the first M is for menses. All right, menses meaning that you have menses very heavy. Okay, menses very painful, plus minus possible endometriosis, or irregular menses. Okay, so using the contraception, it can actually reduce endometrial prostaglandin, and it reduces uterine blood flow, and it reduces the cramp. So you can see the added value. I have some symbol there. Okay, actually I want to put the prawn icon there, but then I don't have the too small or cannot see, so I put some symbol there. So this represents the prawn. Okay, so how many prawn is there? Can you all count? 1, 2, 3, 4, 5, 6, 7, 8. So it's 8 prawn. Okay, 8 prawn means that from a research, it has shown that it can reduce 80% of this heavy menses, reduce painful, and also reduce the irregularity. Okay, means out of 10 ladies, maybe 8 of them have benefit from using the hormonal pill. Okay, the second M is maleism. Maleism is androgenism, means that you become like a male. Okay, how become like a male? So you have acne. Hirsutism means you have hair in your facial, and maybe plus minus PCOS means that maybe you have PCOS, maybe you don't have PCOS. And the last one is alopecia, means losing hair. Okay, this is because the hormonal pills, they can reduce the ovarian androgen, and it reduces the sex hormone binding globulin, reduce the free androgen. Means that using this pill, the male hormone circulating in your body will become less. Okay, and then your sebaceous gland, means that your oil gland become less secretion, and the hair follicles better. So this value added not for all hormonal pills. The main thing, the progesterone you must see is these two things, cyproterone and also dinogestrosperinone. Okay, so you can see the cyproterone. There's 1, 2, 3, 4, 5, 6, 7, 8 prong there. Man, it reduced the maleism by 80%. And if you see dinogest and drosperinone, it reduced by 30%. Okay, so the effect is lesser, but it's still reduced. All right. The third one is for mood problem. Okay, mood problem is like PMS, premenstrual syndrome, or this PMDD, which is severe PMS, which we call that premenopause dysphoric disorder. Means that it is so severe, that PMS, that it affected your life. It makes you cannot function. Then you take one of the medication we call YAS. Okay, that one can also reduce this PMDD. Okay, by reducing the serotonin, by reducing the noradrenergic and the central adrenergic receptor site. Okay, and also alter the folate and B12 to make the patient 80% will be better with this medication. Okay, so you can see that the benefit is a lot, around 80%. Okay, and the last one is something that people will think that you take birth control pill, you can have more cancer. But actually, the reverse is true. Okay, all right. The reverse means that you can reduce the risk of malignancy. Okay, cancer. All right. The first one is ovarian cancer. So the ovary, there is a lot of ovum. So this ovum, it will release. So when it releases, there's some damage inside. So this damage will eventually, if you keep on damaging something, it can become cancer. That's why when you have OC, it reduces the ovulation, it reduces the cancer risk. All right. And it mentioned that in the research, in 5 years, there's a reduction of around 20%, the two prongs. And this, if you take very long term, like maybe 20 years or 30 years, it can improve until 1, 2, 3, 4, 5, 6, 7, 8, 80%. Okay, and it can last for 30 years. So if you take once for 1 or 2 years, it can last for 30 years. And the second thing is the uterine cancer. Also, it can reduce by reducing your endometrial lining, and from the research is 20% per year. And it can up to 50% reduction, and this risk reduction can last for 20 years. Means that you take for 1 year, it will last for 20 years. This is from the research. Okay, and the last one is for colon. This colon, it works by regulate the proliferation and apoptosis, the breakdown of the cells in the colon, and it's mentioned that it can have reduction of 20%. Okay, so this is like a summary slide. Of course, your patient won't ask you, doctor, can you quote me the research, everything, right? So far, I never have a patient I go to you or go to me to ask you to quote. Because all this research is keep on going, evolving. You can ask patient to Google, they can get the result from the Google as well. So I'm not going through all the researches. All right. Okay, so you can see that contraception itself can be non-contraception or can be both. All right. And I'm just ending this talk by quoting one of the contraception hormonal pill, the YAS. Okay, you can see that the drosperinone in YAS, beside the contraception efficacy, it also reduces the oily skin and it improves the acne and is an indicated treatment of PMDD, okay, premenstrual dysphoric disorder. And this is one of the indications for using this. But of course, for you, if you think that patient may have something else, it's better to refer a doctor to have a full assessment first, because it may not have a PMDD, she may have something else like brain tumor and things like that. You make sure you rule out all that thing first, only you assume that the lady have PMDD, okay? All right, one of my idol comedian, but he passed away, his name is George Carlin. Okay, he has a famous quote, he said, all women are crazy. You agree or not? Disagree? Don't dare to agree. Okay? And then his second sentence is, all women are crazy because all men are stupid. Okay? So women are crazy because men are stupid. So this is one of the quote from this George Carlin. So in a way, if you go and think about it, probably could be true, okay? But of course, when you see a patient which is like having a severe symptom, don't assume that it's just a PMDD. You must try to refer a doctor first and see to rule out any other problem, organic problem, okay? And then you can see that dosperenone is the first synthetic progestin, and you can see that the effect is anti-mineralocorticoid. So it reduces the water retention. And you can see there's an extensive study on this YAS, okay? From the contraceptive efficacy, the cycle control, acne treatment, and also for the PMDD treatment, there's already established study. And of course, the safety study is there that this pills, YAS, is safe. And you can see here that comparing YAS and Yasmin, the incidence of blood clot is almost the same, but less with YAS. And the arterial sclerosis also around the same with Yasmin. And this is a thing that we need to know, that this is a safe and there is non-contraceptive benefit, okay? So then another question that some people will be thinking in the mind is about this innovator and generic, okay? So for me, the simple comparison is between the Penang char kway teow and the char kway teow in KL, which quote there Penang char kway teow, okay? The thing is that you can see that what is the difference actually? The difference is the wok hei, okay? Okay, Penang char kway teow we have the wok hei. Wok hei means how to say is the fire from the wok, okay? All right. So for innovator, they have many studies that show them they are beneficial, okay? But for the generic, they don't have these studies, but the contents are the same. So it's just like you have a KL Penang char kway teow, we have the same char kway teow, same tauge, same prawn, but you don't have the same Penang char kway teow. But of course, in KL, you still put Penang char kway teow, because if you put char kway teow, it's 5 ringgit. You put Penang char kway teow in KL, 7 ringgit. You earn 20%. Okay, I understand. So these are the difference between generic and innovator. Of course, the price will be different as well. Okay, so this ends my talk. If I have anything that I mentioned a bit incorrect, maybe later Dr. John or Jaya can correct me. Right? Yeah.
Okay, let's give Dr. a round of applause. Thank you for such a simple analogy. Now we think char kway teow, we think about you and also contraception. Okay, so we are proceeding to a poll session.
Yep.
So if you have not joined, make sure to join Slido. Okay.
Let me show the slide. Yeah.
Yeah.
So this is a question posed by the Bayer team. Do you agree that OC with benefits beyond contraception treat acne and PMDD such as YAS would help women to stay on the OC? Oh, straight away got answer already. Like that would be a bit of how to say it?
So for those virtual participants, make sure to submit your question later on Slido. And after that, we will have a Q&A session.
Michelle, only one question, right?
Any question from our physical participants here? Make sure to ask them, because now is the right time for you to ask.
So, you want to have a seat first? Okay.
Yeah.
I will stand and answer. Okay.
All right. So the first question. Patient worried about weight gain. How do we advise the patient?
Okay, so for me, it's very simple. Okay, so just now the first slide after my very casual question is to show you the progestin, correct? So when you see a patient when they have this weight gain, usually if you take hormonal pills, if you have something, the progestin which is cause you to have less water retention, they won't have much of weight gain. But a lot of times, patients will think that a lot of people say you have weight gain. But mainly, if you take OCP, you are actually having progesterone. Progesterone, the name is pro-gest. Pro means support. Gest means gestation, means they support pregnancy. So when you have pregnancy, you actually have more appetite. So some patients, when they are on COCP, they have more appetite. So when you have more appetite, then you need to choose the food. If the food that you take is more of proteins, veggie, and then these fruits and less carbohydrates, then you have less problem of this weight gain. So a lot of things I tell patients, you take one pill, you think this pill, how many calories? How many calories? Alright? This pills is very little calories, and this pills doesn't actually make you weight gain. Okay, of course some progestin may have some water retention, may cause your weight to gain a bit, but that one is the water, they are not fat. Okay, but if you have good appetite and you choose your food, you take char TDS, you gain weight. Alright, so yeah. Maybe Dr. John can share how he will tackle this kind of question as well. Oh, okay. It's in the next slide. So coming soon.
Yeah.
Alright. If any question that's coming soon, you must stay. I pass to you.
Okay. So
Dr. John is the best person to go to for the contraception. Okay. Okay. Yeah. Okay, second question from Ms. Ho Xiaojin. Yasmin contains dosperenone too. Does it help in acne and oily skin like yes? Alright, so the answer is yes. Okay, right? Because you have the progestin, then it will reduce. Alright, so it does help. Yeah, I think that is the main answer. Alright. Okay, so the next question. Patients asking me if taking OC can prolong the menopause for women. Okay, this one I'm not really sure. Okay, but main thing, what I know is like from you are in the mother's womb, you have a total amount of oocyte. Oocyte, or simple plain is eggs. Okay, so these eggs will keep on declining until one part when it's reached 0, then you consider as menopause. So if your menopause means that your eggs already become 0. And when you take OC, it actually reduces the ovulation. But every cycle, there is already a selected eggs that we are going to, maybe they didn't ovulate, but they're going to die off, okay? Because only 1 or 2 will be released, and the rest will be dying off. So technically, from a scientific point of view, it doesn't actually prolong the menopause. Maybe Dr. John want to complement the answer.
Yeah, I totally agree. Yeah, so taking the OC has got nothing to do with menopause. So if you're going to menopause at 50, you're going to menopause at 50.
Yeah.
Anyway.
Yes.
So the OC is just making your ovaries not ovulating.
Yeah.
That's all. Yeah.
The big myth is always, I don't want to be menopause because I don't want to become old. Menopause doesn't mean you are old. Okay? I see a lot of ladies, they're not menopause, but they look older than people menopause. Why? Because of your habit, your stress, your food, all these things, and your exercise. So a lot of patients, they have potential ovarian, very complex mass, and I tell them, this one possible is a cancer. And they ask me, doctor, you take out my ovary, then become menopause, become old. And I say, so you rather die young or you want to grow old? Then I say, oh, then I grow old, ugly. I said, no, if you take out the ovary, you're menopause, but then you do proper exercise, you do sleep well, you take proper food, then you won't become old. So, of course, nowadays there's aesthetic and plastic surgery as well. Okay, but the main gist is still your lifestyle, not the other things. Okay, the plastic surgery and aesthetic is just an add-on, maybe 10-20%. All right. Okay. So so I go to the next question. Patient newly started on Yasmin for 2 months but did not experience withdrawal bleeding during pill-free period. How do we advise in this case? I think next slide got right? Yeah, next slide got. Okay. Okay. Well, make my job very easy. Okay. Next question. But this one you must save because Dr. John will answer. Okay. This one need a lot of details. How does COC improve the mood by altering the folate and vitamin B12? Alright, that one I haven't gone into depth, but so far this is what the papers have mentioned, that by altering the folate and B12, it improves the patient's mood. So I cannot answer you this one because very technical. Yeah. Alright. So sorry to Ms. Teo. Okay. Alright. Next question. PI. Patient. This is the same question, right? Yeah. Okay. Is COC totally contraindicated in hypertension regardless of the stage? Okay. So it's not totally contraindicated, but when you have a contraindication which could be relative, you must explore the non-hormonal option first. For instance, condom, IUCD. Then if really you exhausted the birth control methods, then only you see how severe the hypertension. If it's a mild, then you need to see the WHO and then you see whether the patient can use or not. Yeah, so these are the things that you need to look for. First, for safety, you need to explore non-hormonal first, then only you consider the hormonal. Okay, yeah. So, okay, next one. Can we start any OCP to delay menses for irregular menses? Need to start when? Which one is preferable OCP? Okay. So the two parts of hormonal pills are estrogen and progesterone. And the estrogen, because of the side effect of this blood clot and some say very, very tiny higher risk of breast cancer, is getting lower and lower, but it's still a level that really can able to stabilize your menses. So the thing that stabilize your menses is the estrogen. So if you want to delay your menses, then you need to take a COCP as soon as possible until when you want to stop to have the menses. Okay, which one is a preferable OCP? I think there is no preferable OCP. It depends on the cause and whether you can able to tolerate. So of course, if you just want to delay your menses, not for any contraceptive, and you can able to take at the same time, you can take the cheapest one, alright? And make sure you have taken the pills regularly. Because if you don't take regularly, like for instance, today you take 9 AM, tomorrow you take 9 PM, then the estrogen fluctuate. Once it fluctuate, then you have the period. Yeah. Is it in your next talk? No. The third one, yes, okay. Alright. So this is the thing that if you want to delay your menses, you can start and you don't stop and you don't forget. Once you forget, you may have a breakthrough bleeding. Right. Okay, the next question is, how young can a female be started with COC for non-contraceptive benefit? How young? No idea actually. Age, I think once you... Yeah, okay.
Age is not in contraindication for any contraceptive method. So as long as they fulfill the WHO MEC. So if they are in WHO 1 or 2, then you can use, and 3 or 4 you can use. So age alone is not a factor in most contraceptive methods.
It's just basically that if you have lack of estrogen and progesterone, then causing some symptoms, then you can use it. So it's not that mainly, this name is contraceptive pill, but this is the function. But the gist of it is the estrogen and progesterone. If that patient have some congenital problem that lack of estrogen, we still need to give, or lack of progestin, we still need to give. There are some instances where they have abnormal genitals, we still give at a very young age. Yeah. So at that point, it's not for birth control. That one is for the non-contraceptive benefit. Yeah. All right. So we can take one more last question, right? Yeah. Okay. So the last question, I encountered one walk-in customer asking for emergency contraception while taking Noculute for delaying period. Is it safe to take? If yes, how to take? 2 hours apart? The emergency contraception, either Ella or Escapel also safe? Wow, a lot of questions. This is like how to say like a question within question. Okay, so basically we break down the question into what is the substance that they are taking. So Noculute is one of the NET, if not mistaken, non-attested testosterone, is a progesterone. Okay, and then that progesterone is mainly to delay the period, alright? But usually when you're on NET, there is a reduced ovulation. It itself is a reduce your chance of getting pregnant. Okay, and then the EC is a emergency contraception, either Ella or Escapel. Escapel is a high dose of progesterone, and then Ella, if not mistaken, is this what is it called? ANSWERR, is it? The selective progesterone inhibitor. Okay. Unipristol, yeah, correct. So this actually, both of them, they are more of a all of them, they are actually contraception, but the different contents, right? So when you have you have this intercourse, and then you want the emergency. Of course, when you're on Noculute, it's already reduce your chance of pregnancy. But if you want to reduce further, you can take Ella or Escapel, but the side effect will be more because in your body, suddenly there's a surge of this progesterone.
If I may add, Ella is selective progesterone receptor modulator, which is actually an anti-progesterone, right? So the only thing is, of course, if you're on Noculute, you already got progesterone there. So when you give an anti-progesterone, the Noculute may actually decrease the efficacy of Ella because it's opposite action. And usually when you give Ella, then the WHO MEC recommends that at least 5 days of no progesterone, concurrent progesterone. So the effect may be a bit less effective, so to speak.
Less effective.
But doesn't mean that you can't actually give. But perhaps in this case, Escapel may be more preferable.
So you can give the Escapel and together with the Noculute you can continue. Yep.
Yeah, I think that's.
Thank you, Dr. John.
Thank you, Dr. John. Thank you, Dr. Low. Thank you for all the questions as well. So now we'll proceed.
Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.